The ones we don't know, we don't know.
I have absolutely no idea what's going on.
In today's top trender, census insensibility.
Looks like the GOP is still trying to convince the public that Obamacare's successes aren't what they seem.
There are new allegations today that the administration is, quote, cooking the books on the Obamacare numbers.
Conservatives claim census changes will hide Obamacare's effects.
This, to a lot of people, is awfully convenient.
Spokesman for the Speaker of the House, John Boehner, saying how convenient.
It might make Obamacare seem more successful than it actually is.
Spokesman for House Majority Leader Eric Cantor said the Obama administration now changing the census survey in order to hide the failure of Obamacare.
They will, I am sure, pocket whatever talking point that they can get out of this.
Joining me tonight, Congressman John Garamendi of California. Congressman, always a pleasure. Good to have you with us. What's your response to the right-wing claim that the changes in the census is the administration cooking the books to make Obamacare look better?
Well, Ed, your entire show is, wait a minute, let's just get the facts before we go off in one direction or another. And this is one where we really ought to get the facts. The Census Bureau is actually changing some of the questions having to do with insurance. Those questions are in use now, testing and trying to find out how many people had insurance last year before Obamacare really went into effect. Next year, 2015, they'll ask the same questions, and then we'll be able to know, really, whether Obamacare really worked or not and what the effect of it is. So it's not hiding anything. It's actually getting to the facts. Then we'll be able to use comparing 2013 to 2014, before Obamacare and after it really goes into effect. That's a really good thing to know.
It is a good thing to know, and they're not going to like the numbers. They never will like the numbers. But I want our audience to know that if they don't know, that you are the former insurance commissioner for the state of California. How do insurance companies calculate exactly who had insurance, who didn't have it? Take us down that road. What would be a perfect way to calculate to get an accurate number on exactly the effectiveness of Obamacare?
Well, if we were able to query every health insurance company in the United States, we could get a number of exactly how many policies they had in 2012, 2013, or even in 2014. It can be done. At the moment, those insurance companies are not required to report that information. It would give us the accurate information, but also you could break it down month by month, because people move in and out of the insurance marketplace. They have a job, they lose their job, they lose their insurance. Incidentally, under Obamacare, that won't happen anymore, because you do not lose your insurance when you lose your job. So we would be able to, under that scenario, the Census Bureau is actually using a statistical model. It's used by every pollster, whether they are polling the presidential campaign or a congressional campaign or a city. They use a statistical model. That's what they're doing. They're trying to get the very best questions so they can get accurate answers, and they frankly have tested these questions over the last decade, checking the accuracy, modifying the question again, checking the accuracy. So we ought to have a good notion of exactly how the Affordable Health Care Act has impacted America. Right now, the best estimate is from the Congressional Budget Office, nonpartisan. 12 million people who didn't have insurance now have insurance. If that's anywhere near accurate, even if it was 10% off, that is a huge victory for the Affordable Health Care Act.
No doubt about it. And isn't the CBO really the best measurement? Because we did health care reform in this country because the numbers were killing us. I mean, we've already seen the savings. We've already seen some of the savings, which is, I think, the tip of the iceberg of what we're going to benefit from as a country over the next decade when it comes to cost saving in the delivery of health care. What about that?
Well, it's absolutely true. You see it already. When people are insured, they get early health care. They don't have to wait until they're really, really sick and wind up at the emergency room. So you're able to deal with whatever the issue is in a more cost-effective way. We've seen very significant reductions in the Medicare costs, down each year over the last 3 years, largely because under the Affordable Care Act, seniors are able to get an annual checkup. And so if they're headed for diabetes or heart issues or high blood pressure, you're able to treat that before it becomes a very expensive, debilitating, or bringing on death.
All right. Congressman John Garamendi, always a pleasure. Good to have you with us tonight, John. Thanks so much. Appreciate it. Still ahead, 40 years after Hank Aaron received racist hate mail for breaking Babe Ruth's home run record, a new flood of vile letters are being directed towards the Hall of Famer. Rapid Response Panel weighs in on that. And later, a move towards privatizing the Postal Service outsources union jobs to low-wage retail workers. You won't like it. Up next, taking your questions. Ask Ed Live, coming up on the Ed Show on MSNBC. We are right back.
I hope our immigration policy gets fixed.
I hope children can get a quality education.
Protect voting rights and
raise the minimum wage.
Hope grows, echoing across America. And as hope grows, so does the power of people. MSNBC will be there, listening, sharing, amplifying your hope.
Join MSNBC for special broadcasts from America's college campuses. Now with Alex Wagner, April 25th, and Politics Nation with Reverend Al Sharpton, April 30th. Learn more at msnbc.com/growinghope.
Hey, I'm Ted, and this is Rudy. Say hi.